My first feeling was disbelief, really followed by sadness, outrage, and even shame. Shame that our colleagues in this amazing organization who are mandated and trusted to save and serve people and help people could be harming people at the same time.
Dr. Gaya Gamhewage is the Director of Prevention and Response to Sexual Misconduct at the World Health Organization. In this compelling conversation, she sheds light on her experience and the critical issues of sexual misconduct within the humanitarian and development sectors.
Sexual misconduct on the surface seems like it's about sex, but it isn't. It's about power and the abuse of that power. And when somebody has power over somebody, it may lead to sexual misconduct.
The conversation brings up the significance of personal responsibility.
There is nobody in WHO or the UN who can say, this is nothing to do with me. There is something you should do.
She highlights the urgency of a cultural shift within the organization.
How we behave is as important as excellence in public health. And it doesn't matter how brilliant you are. If as an organization we don't have good standards of conduct, we are not going to be trusted to deliver public health.
This is the #NoExcuse podcast. We discuss the challenges, complexities, and potential solution in preventing and responding to sexual exploitation, abuse, and harassment in the humanitarian and development sectors. You'll hear interviews with victims and survivors, experts, aid workers, artists, and leaders. The podcast is produced by the World Health Organization's Department for the Prevention and Response to Sexual Misconduct. I am Guni Dias, your host and Global PRS Network Coordinator for the department. So I really wanted to start the podcast series by interviewing you, not only to explore the journey into the prevention and response to sexual misconduct, but also to help our listeners to contextualize the podcast. So at WHO, sexual misconduct is used as an umbrella term to encompass sexual exploitation, sexual abuse, sexual harassment. These are traumatic events that evokes a range of different feelings. What feelings do you associate with PRS or the prevention and response to sexual misconduct?
I think my feelings have been changing during the last 2 years. I remember right at the beginning when we heard about the allegations of sexual exploitation in the 10th Ebola outbreak in the Democratic Republic of Congo. I think my first feeling was disbelief, really followed by sadness, outrage, and even shame. Shame that our colleagues in this amazing organization who are mandated and trusted to save and serve people and help people could be harming people at the same time. So this was really a really difficult time, not just for me, but all colleagues, particularly in the health emergencies program, because these allegations were linked to the Ebola response. It was a very, very difficult time, and many of us had to be quiet and think about what this meant for us. Some of us were very angry. And then in July 2021, the Director General invited me to lead this under his guidance. I was really, I think, very excited that finally we would be able to do something, not just because I was asked to do this work, but because I had trust that the Director General really was committed to making a change in this area. But of course, I wasn't naive. I was also a little apprehensive, a little afraid, because it was such a big and complex task. But in my mind, I knew I had to step up and do it because I love this organization so much. And now I think 2 years on, and many people have walked this journey with us. It's not me alone. I really feel grateful for what we've been able to achieve. We've had lots of achievements. We have new policy. We have capacity around the world. We have funds. We've started changing how we assess risk. But also at the same time, I am still apprehensive because there is so much to do. But equally, I feel very inspired and grateful for colleagues who are not even directly involved in this work, who will just stop me when I travel or when they see me, and they will just say thank you, because this is a job that needs to be done. So I know it's in their hearts. I'm also still inspired by the courage of survivors, people who come forward and make these allegations. I'm also really inspired by what some of our partners are doing. So there is a whole lot of inspiration. But of course, I remain very curious and wanting to learn about how we can do this better. So it's been quite a it's been like a roller coaster of emotions.
I was going to say.
And every day, sometimes I feel all of these emotions in one day. But also, it's also part of the skills we need to acknowledge and deal with our own emotions, especially in a topic like this.
Yeah, I mean, working with you, I've experienced them myself. And given the context, be it in international organization, I think that, adds a layer to this. So based on your experience, why is it so difficult for us to speak about sexual misconduct within an international organization?
So I think even before we get into the international organization, we have to acknowledge this topic of sex, sexual beliefs, sexual practice. This is such a personal and intimate thing. Of course, I'm an older person, I'm 58, and I was socialized not to talk about sex. It was very private. You didn't talk about it. It was something you shunned away from. We didn't even have vocabulary. So I think there's a fundamental issue with the topic. But we also have to remember it's difficult to talk about it because sexual misconduct on the surface seems like it's about sex, but it isn't. It's about power and the abuse of that power. And when somebody has power over somebody, it may lead to sexual misconduct. And institutions are essentially power structures. They're built to maintain hierarchy so that they can be efficient. And there is a need for hierarchy and power structures. But particularly organizations like ours, built 70 years ago, and the UN, is inherently a power structure. And in that power structure, there are lots of explicit and implicit opportunities to exploit this power. I think the third reason that people don't talk about it is many people don't want to be a victim. They don't want to appear weak. All of us who've experienced any form of sexual exploitation, abuse, harassment, to whatever degree, our first instinct and the way we were socialized is to ignore it and not to complain.
Right.
And girls particularly are taught not to complain. And if you did complain as a woman professional particularly, you were seen as weak. You were seen as a troublemaker. So what happens is people who experience this take their pain and hide in the shadows. And the pain grows there, but they don't want to make anybody else uncomfortable. And at the same time, this allows perpetrators to go unchecked.
And continue.
And many perpetrators you will see are serial perpetrators. But coming to that last point, why is it so difficult in a multinational environment? Well, it's even more difficult because each of us, we come from different cultures. And again, sex is part of the cultural norms of a society. How we think about it, what entitlements we have, what we think is right and wrong. And when we mix all of these nations together, it's very difficult to get a common standard. But we have to realize and understand why the United Nations and WHO were created. They were created to protect and promote and unleash a common humanity, and to protect and to make sure we attain everybody's human rights. And therefore, we have to come together, and it's very difficult when you're from different cultures, but we must live up to the standards that we've set for this common humanity. So those of us, all of us who basically are in an organization that is trusted to save and serve and help cannot harm people, whether it's people in communities we serve or people in our workplace. So while it's difficult, it's also easy when you bring it to that level.
Right.
It's about our common humanity.
And it's also institutionalizing some of those standards, right? And we've been speaking about WHO, but it's not only a WHO issues, the prevention and response to sexual misconduct. But if we focus back on your work, WHO's end goal is to work on prevention work related to sexual misconduct. How can we help people, or what can we say to people so that they can start incorporating prevention behaviors or actions to prevent sexual misconduct from happening in the workplace or in their everyday life?
So I think there's a lot we can do, and we actually have a very detailed accountability framework that is for all of us. So if you are a team assistant, if you are a professional staff technical officer, you're a national professional officer, you're a driver, you're a logistics officer, you're a supervisor, a manager, a director, an assistant director general, or you're one of those special teams that has a particular role in this. For example, the investigation team, iOS, ethics, our own department, PRS, human resources. This accountability framework outlines exactly what is expected from all of us.
Right.
Our first job is to familiarize ourselves with that. But actually, if I want to simplify, I would say there are things you should know, there are things you should feel, and things you should do. So what should you know? First, you should know that this is real.
Right.
This is not made up. This is not exaggerated. This is real in all institutions, including ours. So we have to stop burying our head in the sand and being in denial. This is really, really important. This is the first thing to know. We need to come out of denial. We need to learn about the policy, but not just the policy, but why we have that policy. What is the intent of that policy and what is required from us in that policy? We have to learn about the fact that each and every one of us, we are essential in this journey. There is nobody in WHO or the UN who can say, this is nothing to do with me. There is something you should do. So what you should feel? What should you feel? You should actually feel outraged that this is happening at our hands and we have collective culpability in this. And we have to feel compassion, particularly for victims and survivors. Because let's be honest, most of the systems, most of the laws, most of the regulations in the outer world, within the UN and even in our organization, because we are created by the world, is pro-perpetrator.
Yeah.
It's not pro-victim yet. It's not pro-survivor yet. So you have to feel great compassion and anger about that. But also we have to quickly turn that outrage, use that compassion and turn it into optimism that we can change this, but only if we act in concert together. So this helps you know what you should do. You should read and know your accountabilities and fulfill them, right? So you have to report, there's mandatory reporting, you have to take trainings, you have to participate and educate yourself in all of this. You need to learn about your own biases because ultimately this is about human behavior and our culture.
Yeah.
We have to learn about ourselves. We have to learn emotional intelligence. We have to learn how to talk about this in a constructive way. And we have to get the skills to do this. And that's the only way we will become champions. And it's not some vague campaign. This is very fundamental. Imagine this with your own home. And you're in charge of your home. Would you allow anybody who visits, who lives there, to harm anybody else there? Would you allow that? You would not. So we have to treat our workplace and the other places in which we work in the same way. Right? So we know what is good behavior. We know what it is. And we just have to apply that same set of feelings to our workplace and keep the same standards.
In the work we've done so far, Gaya, I think we can agree that we've met people or colleagues that do not feel that they are part of this. They can't relate to the subject, they can't understand, and they feel that that doesn't affect them. Why do you think that there is a need for a podcast on this subject?
So podcasts are amazing tools. I myself love podcasts, and podcasts are amazing because 70% of our human brain is dedicated to visual stimuli, right? So things we see, but also things we imagine. And just by closing your eyes, you'll see you can focus. So when you want to really focus on something, lots of people close their eyes. When you want to meditate and cut out distractions, you close your eyes. What you're doing is you're engaging only your ears and nothing else. And this is what a podcast does in this era of distractions, because attention is the commodity that we are least in possession of, right? And everybody is vying for your attention. And podcasts, when you're listening to a podcast, you're engaging just that sense of hearing and you're able to pay attention. So actually, in terms of neuroscience and biology, it's a very good idea to have podcasts. Then I think the second is that, the human voice is really powerful. It's how we really learn about the world. We heard our mother and father's voice before we could really see them. It's an evolutionary fact that we really react to stories, human stories, but human voice is so powerful. And podcasts allow us to focus our listening, but to humans. But also a podcast isn't a speech, right? So it's an interaction. And people love hearing conversations. They like the natural flow of conversations. Also, a podcast allows you to go beyond this 140 character tweet, right?
Right.
Which it allows you to have a series, to have an in-depth discussion, explore different topics, and explore different perspectives, which is really important. And I know this podcast series, you're going to have guests from inside WHO, outside WHO, people who are directly linked to this, who are not directly linked to this. And I think finally, all of this acknowledges that we have a lot to learn. So why do we want to get everybody's attention? Why do we want people to focus? Why do we want them to hear human conversations about different perspectives? This is an admission that we have a lot to learn. And learning together is the best way of learning. So there is really, if you look at it, there aren't many experts in this. And I hope nobody wants to be an expert in this. I hope we can deal with this phenomenon. But we can learn as human beings and as people who work for this very, very esteemed organization, how we can really understand in different ways. And you talked about some people feeling, not engaged in this, feeling this is not relevant. I think a podcast will help them understand different perspectives, so there will be a perspective that relates to them.
Right.
And last but not least, we are so busy. Some of our colleagues, we have 2,000-3,000 people, colleagues who are very busy, who come to our live webinars, and I really appreciate that. But then that leaves another 11,000 who don't. So I hope the podcast will be used by some of those people as well, including the people who come to our live events, because you can listen to it while you're driving, while you're walking, while you're cooking, while you're doing something else, right? Because you can engage your hearing and your heart, if you like, when you listen to a human voice. So for that, I'm a real big fan of podcasts. And I really hope that, WHO personnel, but also people outside the organization, tune in, sign up, and hopefully they are interested in this. And of course, they can also, I know, tell you, if they want to be interviewed or they have something to say.
Yeah.
So I think it's a really amazing tool in this age of distraction.
Yeah, and provides in depth. It gives nuances to conversation, to stories. And also what I like about podcasts is just the voice. So the face of the person will not matter. It's just their voice and what they have to tell you. It's just tuning into just that voice for 20 to 30 minutes, not too much of your time, and see how you can contribute to that.
Guni, if I can jump in, also, I know you run the global network of our focal points. I think we would love to hear from them.
Definitely.
And they would love to hear from each other as well. So the practitioners, the front line, is very, very important. Again, if we approach this with humility, that we can all learn together, I think we can really make a difference. We cannot just set out policies and rules and expect the place to change. This is really understanding culture and engagement are key to this.
Definitely. I think that there is this need for a change of culture, and a podcast is a candid way to facilitate and to not judge each other and to ease into what is okay, what is not okay, and have this conversation. Talk briefly about culture change. What would be a culture change that you'd like to see at WHO?
I think that everybody admits that while we have a lot of problems and challenges to address in public health, but also in the way we behave, and this falls into that category, the way we behave, I want everyone to acknowledge that how we behave is as important as excellence in public health.
Right.
And it doesn't matter how brilliant you are. If as an organization we don't have good standards of conduct, we are not going to be trusted to deliver public health. So I want people really, that would be a big culture change,
Right.
that we don't look at ethics and prevention and response to sexual misconduct and prevention from other forms of abuse as extra things, but as the core character of this organization. So I think that's a first culture change. The second is, as I said, really for us all to know, feel, and do those things so that we can start having honest discussions. You know, we are not passive recipients of culture. We make culture. People make culture. And I want people to step up and to help shape together the culture we need to continue to do amazing public health work. Now, nobody knows what that will look like, but we need to co-create it. But if people are not engaged, we will create something that works for some people, but not for others. So it's very important. Participation, engagement is very important. And really that shift in thinking, you know, come from denial to accepting the reality of this, come from feeling just angry and disappointed to becoming optimistic and becoming a co-creator. So those are some of the things. But as I said, we have to discuss and create our culture together. And I'm part of that.
That's
I
right.
cannot be culture change. I can contribute, but everybody else must contribute too.
Is there anything else you would like to add to the conversation on the prevention and response to sexual misconduct?
Just to say that, you know, we should actually take a moment to feel good and proud about what we've done in the last 2 years together.
Yeah.
We've made a big change, and our member states and our partners and others are beginning to notice it. In a very short time, we've been able to achieve things together. So our investigation function, for example, is working really well. Our capacity around the world has increased.
Yeah.
The Director General has kept to his commitments and provided funds not just for capacity and prevention, but also for the Survivor Assistance Fund. I mean, the way we are supporting survivors in the Democratic Republic of Congo is really, I think, very innovative and very comprehensive. And we have to remember we're helping all survivors, not just survivors affected by WHO personnel. We are beginning to assess risks. So we have a list of achievements. So we should take a moment to feel proud of that. But we cannot rest there. We have a long way to go. And we have to acknowledge we're still slow after the post-investigation phase. So the whole process for victims and survivors is taking too long.
Yeah.
Our victim survivor support, while better than many agencies, is still not good enough. It's absolutely not good enough. And we have a lot of work to do there. And we have really to improve how we change the whole organization, not just related to sexual misconduct, but all forms of misconduct. How we deal with gender, the fact that we don't have gender parity at the senior levels of this organization, how diversity, equity, inclusion is addressed.
Yeah.
So this is a whole of organization set of things. Now, the first period was, if you like, easier to do.
Right.
Now, the next period is going to be hard. But I would really like everybody to read our vision, that we see a world in which no victim or survivor goes unheard or unsupported. No perpetrator goes unpunished when after an investigation substantiates those. No person, nobody working for WHO, including our implementing partners, have an excuse to say they didn't know what was wrong and what they should do. And that our implementing partners are held to the same standard. Now, it will take time to do all this, and we have to do this with other agencies. But I want you to buy into that, step into that space, and know that we have achieved a lot and we can achieve the rest. So I want people to feel optimistic, but not let down their guard and let this drop.
And to kind of close off our conversation today, could you give us your thoughts on why #NoExcuse, the podcast, the name behind? Because it can sound very draconian, very strong, and it's like, there's no excuse for anyone not to know what we're doing, which I think at this point in time, with how much of information we've put out there, people might feel a bit overwhelmed. But what's the thought process behind the name of #NoExcuse?
The slogan, no excuse, has been in use in the UN. We didn't create it. But I really thought it was really perfect, because when the allegations came out in the Democratic Republic of Congo, some of the things that we heard sounded like excuses to me. They sounded like excuses. And actually, you would agree, if we take it, and let's say there's a child in our care, right? In your family, there's a child. You cannot give any excuse for any harm that comes to that child. You cannot, right? Same way, we cannot give any excuse for harming other people. It is difficult. It's difficult to think about it when we are being shot at, when we are working in secure situations, when we have deadly epidemics to control. Yes, it seems like there are factors which make it complicated, but there is no excuse. And I think it is about really feeling that, to say there is no condition under which this is okay.
Right.
It's as simple as that. You don't have to be very clever. You don't need to have 3 degrees or a PhD, or you don't need anything. Any person on this planet can understand there is no excuse for harming other people. And for me, it stuck. All I did was add the hashtag. And as you know, I have a brooch which I wear in a very flashy brooch, because I'm proud to say that this should be our guiding principle. There should be no excuse. And I think we like to keep consistency. So our webinars, our open doors, our everything we do, I like to keep under this. I hope there is a time when we can change the hashtag to something else. But currently, I think it's very, very valid.
For sure, Gaya. And I think that this podcast gives really the idea, the concept, the interest in having this podcast is to say to people there is no excuse for them not to know how to behave in a way that we prevent sexual misconduct from happening. But it's also a very candid and a softer way to go about things and to get people into the bandwagon to understand that this is something that is they are involved in this change. So there you have it. Discussing about sexual misconduct can be difficult. It can be uncomfortable, as Gaya said, and sometimes sensitive. But through this podcast, we hope to have candid conversation with people, be it internal or external to WHO, to listen and learn from each other. So thank you, Gaya, for giving us space to have these conversations to happen.
Thank you, Guni. It was my pleasure. And I really invite colleagues to subscribe and to be a more active part of this journey. And the first step in being that active part is active listening. And therefore, this podcast gives you that opportunity to listen and to actively listen, so you can figure out exactly how you want to contribute in addition to meeting your accountabilities. So thank you, and thanks to all the listeners.
Thank you for listening to this episode of the World Health Organization's #NoExcuse podcast. We hope we've given you another perspective on preventing and responding to sexual misconduct in the humanitarian and development sectors. We release new episodes every 2 weeks. But if you have any feedback, questions, or suggestions in the meantime, feel free to reach out at prseah@who.int. Until the next time, goodbye.